regular but remote meeting of the Board of Health to order. It's now been 8 months that we now have been meeting remotely. I have no predictions when we'll be able to go live. Board member Libby Wollengevitz will represent everyone in her reciting of the Pledge of Allegiance.
Thank you, Dr. Weiner. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Libby. I'm Ed Weiner, and I'm chairman of the Burlington Board of Health. And with me this evening is David McSweeney, vice chair, Dr. Wayne Saltzman, member, and Libby Wollengevitz, member. Mary Beth Welch is ill this evening, and we hope that she feels better soon. Also with us tonight is Susan Luminello, our Director of Public Health, Christine Mathis, Environmental Engineer, Sarah Kodamash, who is our Board of Health Administration and IT host this evening. And I have not seen, but I am assuming that Dawn Cathcart, our recording secretary, is present. Dawn, are you on?
I am.
Thank you very much for coming this evening. We appreciate it. Last, I want to thank the outstanding BCAT professionals who work so hard to make this program and many other news programs for this town possible. Tonight we have Chris Flaherty, who does so much for BCAT and so much for this board and the community. Thank you, Chris Flaherty. We are still operating in a declared state of emergency with special rules for public meetings. Mr. McSweeney, our Board of Health Vice Chair, will provide the legal requirements for this evening.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. As a reminder, that persons who would like to listen to or view this meeting while in progress may do so by tuning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the phone at 408-418-9388, meeting number 173-874-5436. That's 408-418-9388, meeting number 173-874-5436. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address. And as a reminder to all board members that all votes are required to be done by roll call for these virtual meetings. And with that, I turn it back over to the chair.
Thank you, Mr. McSweeney. Again, please note we're live on BCAT and available for comments and questions through this amazing video technology. Everyone, as I have mentioned in the past, these remote meetings and chairing remote meetings are not easy. Preparation is many times that of an in-person meeting. Please understand, in this pandemic, we are all in this together, and please have patience. Next is citizens' time. Sarah, do we have anybody on the phone or anybody on BCAT who is not on the agenda who would like to address the board?
I believe all the applicants are on the call, and if anyone is not an applicant but would like to speak, please unmute yourself.
Hearing none, we'll go on to Chairman's report. On behalf of the Board of Health in the town of Burlington, I want to express our condolences to our director, Susan Luminello, on the death of her mother-in-law, and condolences to our supervisory nurse on the death of her father. Our thoughts and prayers have been with you, and they remain with you and your families. Thank you so much. I want to thank everyone on this call, as well as every member of the Medical Reserve Corps, the DPW, Rec Department, and school departments, as well as police and fire, who did so much to make our flu clinic and emergency drill such an outstanding success. I also want to report that Dr. Wayne Saltzman and I separately were interviewed by BCAT on both the pandemic, the flu clinic, and having a safe Halloween. In addition, Susan Luminello presented within a BCAT special our role in the opening of this year's schools. To answer key questions that I routinely receive, this board is in daily communication and closely works with the Burlington Public Schools and our business community and our citizens to assist in keeping everyone safe. And last, you may have seen in posts on multiple Facebook groups on the importance and understanding of our flu clinic and an emergency drill. People have responded, and I hope they understand why we do what we need to do once a year. And last, at the next meeting, we will be discussing a very important issue. It is a sensitive issue, but very important. And that is the establishment of an additional permanent position, an Associate Director of Public Health to our department. I have spoken to our town moderator, our town administrator, and a member of Ways and Means. This board cannot be any more busy, and we need some extra help. So we will be discussing it at our next meeting. Are there any questions before we move on?
Mr. Chairman, and we talked a little bit about this at the last board meeting, and I'm fully supportive of adding any and all resources to help. As we know, we're seeing a surge now, but we're going to continue to see a surge. And I do think if we're not getting ahead of the curve from a resource perspective, we are doing a disservice. I'll defer to the chair on this, but just my thoughts are, any thoughts around developing a subcommittee to help drive that resource through the channels and developing the role and all those types of things.
Well, a subcommittee meeting would be very helpful in the next week or the week after, prior to our next meeting. I will speak to the Director of Public Health about the possibility of putting a subcommittee meeting together. I think it's a great idea and a great suggestion. Thank you, Mr. McSweeney. I forgot something, and I do this every once in a while. We have minutes from October 13th to approve. As you notice, it also says minutes from September 22nd, but I cross-checked and we've already approved those minutes. So I'm going to ask, and I do apologize, I'm going to ask for a second to approve the minutes for October 13th. Are there any omissions, corrections, or additions?
Motion to approve.
I have a motion to approve. Do I have a second?
Second.
I have a second from Mr. McSweeney. As you heard, I have to call a roll call vote. David McSweeney,
Aye.
Dr. Wayne Saltzman,
Aye.
Libby Wallen-Jevons,
Aye.
and I vote aye, and that's 4-0. And I do apologize. Sometimes I miss the minutes, and it was by accident. I apologize. Are there any subcommittee reports? Okay. So the next on our agenda is applications, site plan and special permit applications for 300 Summit Drive. Do we have our environmental engineer, Christine? Are you on?
I'm here. Yes, I'm here. Good evening.
Christine Mathis, our environmental engineer. Would you please present this to the board?
Sure. I think the board's very familiar with this site. Most recently, this past summer, you heard and approved a preliminary and definitive subdivision to create this lot that we're talking about, which is newly created Lot 300. The proposal is to build a office and laboratory building on that newly created lot. Enhanced stormwater will be added to accept the additional impervious surface, and that will include a third underground infiltration system, a bioretention area, and the movement of a detention basin. There's currently a detention basin on the site that was built when the Millipore buildings were constructed. That will need to be moved and slightly enlarged under this new design. I see that we have Scott Weiss here. Scott, can you share the site plans? Do you have those?
Sure. Just with me tonight, I just want to acknowledge that we have Attorney Buckley with us. Also have Will Park from Sims Maney McKee. He can do the plan sharing, and we do have Matt Heil, I believe, is on as well from Sanborn Head. He's the LSP on the project.
Okay, great. So I
If
guess-
Will can pull up a plan, maybe the
if we-
aerial colored plan might be helpful.
Yeah, and the board has that in your board book materials as well. There's a,
Would you like us to go through it, or did you have more to present, Christine?
I just wanted to make a quick statement about the placement of the new parking garage. Because the board is familiar with the fact that there's an area of consolidated contaminated soil on this site that was done as part of the Millipore, construction of the building for Millipore. And that soil is the subject of an activity and use limitation. And under this proposed plan, the parking garage structure will actually go on top of that lead consolidation area and act as an even better protection for that AUL area. So if you want to go through the rest of the plan, that'd be helpful.
Sure. I'll just give everybody a quick overview, just to orient everyone and as to what they're seeing. And Will, if you zoom out just a fraction, a little bit, you can see at the very bottom right of the page, the existing Summit Drive coming up the page, and the driveway goes around with 200 Summit Drive, the old Siemens Nixdorf building, wind tower, people remember some of that, building on your left as you go down that driveway, and the driveway continues around to the building for Millipore Sigma, which is the existing building in the back. As Christine said, we created a new lot for a new building, 300 Summit, pursuant to the zoning changes that were adopted by town meeting over the last couple of years to help promote life science development within the community. And this project adheres to the new zoning that has been put in place and adopted for the Summit site. What you see here in the white outline area is the building itself. That would be 4 stories of a building, of a lab building, sitting on top of 1 level of parking underneath. Actually, to orient everyone, north is to page right, and just off the sheet, running along that right edge would be I-95 or Route 128, and you can see the ramps that go to Route 3 on the edge of the plan on the upper right as well. So north is in that direction. Just to the west of the building, there is a surface parking area, actually just a triangular parking area, Will, just to the west. And then just south of that, as Christine said, there is a parking area with a single level parking deck over one level of on-grade parking. In the center of that is where this activity and use limitation area, or AUL area, is located. That was the consolidated lead contaminated soils that the Department of Transportation had left after they had removed the highest concentration soils from the site. They left the lower soils buried in that area with a demarcation layer on top. When we constructed Millipore, there was some additional soil put on top of that to raise the grade in those areas. And the parking level and the parking deck are located such that the idea is that they would cover this without excavating down into the AUL area. And so it would sit primarily on top of that, providing a more protected permanent cover as well. So that's a pretty brief outline as to what the building is and the project is. We have applied for special permits with the planning board pursuant to allowing life science development, lab building on the site. As you know, as you guys are well aware, any project that comes forward with life science use would be subject to Board of Health regulations, including the Board of Health life science permitting. So that would be handled separately for a specific user. And then we have also submitted the required Board of Health documentation and application for stormwater as well. So that information is all submitted to you. So that's a quick summary. We're happy to go into details. Both Will and Matt Howell from Sanborn Head are available as well to answer any more detailed questions.
Thank you. Have you seen our 16 proposed conditions?
We have.
Okay. So let me open this up first to any comments from my board. Christine, first of all, Christine, do you have any other comments? Are you all set? You've presented them all. Christine, you're on mute. Christine, do you hear us? Nod your head.
Yeah, hi.
Okay.
I just wanted to point out that the site is located adjacent to a disposal site that has active groundwater extraction and treatment. It's the old US wind power site. They have down gradient property status for a very small portion of the site, primarily in the area where you see at the bottom, you see a triangular shaped green unit. That's the new detention, the proposed detention basin. That's the area that is primarily covered by the down gradient property status. There might be a little overlap with a portion of the building, even though and Matt, please speak, you can speak to this as well, but even under the MCP, the site would not require to have a vapor barrier under the building, but we've put that a condition in as is consistent with other similar sites where we have proximity to chlorinated solvent, groundwater contamination. So that will be under any portion of the building that would be occupied. There is a portion of the building that will have an open-sided garage parking underneath, and that would not require the lining.
Okay, Susan, do you have any comments, or you have yielded to the environmental engineer?
I might have a question for the LSP. I don't know if the LSP is Matt Heil is gonna talk at all about the contamination, but I'm just wondering about having the detention basin over the portion of contaminated area, whether or not, what his opinion is with regards to, and this may be in the conditions that we need this later on. But with regards to adding water there in that area.
Yeah, that was covered in Matt's memo. He can speak to that if he's on. Hopefully it works. Where the detention area is going to be a clay-lined detention pond, not intended to allow or promote infiltration. And Matt, are you there?
Yes, that's exactly right. We plan to use a low permeability soil to line that. So if anything, that would reduce the amount of infiltration that might already be there. But again, keep in mind, we're just clipping that far northeast corner and no further. And in fact, it's pretty deep. You might recall this is really about fractured bedrock. Where the worst of it is. In fact, there's in the overburden groundwater, the shallow groundwater, there haven't been any detections.
Okay, then I'll open up to the board. Are there any questions?
Mr. Chair, I just have one question. I think I just want one question. What is below grade? Is it a basement? Is there going to be offices? And I guess, do you have a tenant for this building yet that you're building for?
So I'll take the second question first. We do not have a tenant yet for the building, and the way the market is very typically at this point, very focused on having a building ready because the needs for these come up quickly, even though there's an extended time frame to construct. So we want to be in a position to deliver quickly. We do not have a tenant lined up. The bottom floor is actually a parking level. But there will be some areas where services and access will drop down to that level. So you'll have a lobby at the bottom floor level, so people who park there can walk into a lobby and then go up into the building. You'll have some stairs. You may have some storage or other features in the bottom floor. But the bottom level of the building is essentially going to be parking.
And is there? I'm not sure of the grade of this land. I haven't gone back and looked at the map, but is it totally underground, the parking, or is it open in some areas?
Yes, it will be open. So if you look on the left side of the building, which would be the main entrance, there's a area where there's some parking and the like. You will walk into essentially the first floor, and the parking would be buried around there. But as you drive around the back side of the building, which faces the highway, that whole side would be exposed on that area because of the grade change from front to back, almost like a walkout basement, if you will.
Right. Yeah, that was kind of the gist of my question. Yeah. Okay.
Yep.
So is the walkout, if you will, the walkout basement is towards the entrance of the building, towards the left side of the building?
Yeah. So the walkout entrance, and what you see is there's a driveway that goes around that side of the building. That's actually somewhat
Yes,
the
I
back
gotcha.
side of the building.
Right.
And that driveway is the access to the parking underneath.
Gotcha. And that building that's, I'm assuming is maybe south, if I got my bearings correct. The current building that's, is that Millipore, correct, currently?
So, yeah, if you can see the cursor,
Yeah,
it's
I
being
can.
highlighted. That is the Millipore building that's there today.
Gotcha. Okay. I have no further questions, Mr. Chair. Thank you.
Thank you. Anybody else? Well, I'll go through my list. First, Mr. Buckley, the AUL is located on the deed, is that correct?
That is correct.
Thank you. The second, I had to put on magnifying glasses to look around the detention basin, and it looked like there was a guy wire around there. It's a very deep basin. Is there some type of barrier around this basin?
I don't believe there's a guy wire. Maybe there's some leftover notation, but Will, do we have any type of barrier proposed, a fence or otherwise? If not,
I think it's on the plan.
Pardon me?
I think it's on the plan, some type of a barrier. I just want to know what you were thinking.
I don't believe we're proposing a full fence around there, but there
Not
is
a
a
fence,
guardrail.
a guardrail. Okay,
There is a
Guardrail, yes.
guardrail along this emergency access
okay,
drive.
that is. There is a guardrail along. Okay,
Yep.
that's what I'm looking for. We've had cars drive into these, and if someone drove into this one, it would
And
be
just Dr. Weiner, just to follow up on that, that, as Will indicated, is actually intended to be a multi-use path, if you will. The two uses are a walkway, bikeway, and the other use would be emergency access. So it's a wider walkway, but it's not intended, it will be gated. It's only intended for emergency use.
Thank you. Okay. Next question. It's going to hold water for a very long time after a 100-year storm or even a 50-year or 25-year storm. I'm wondering where is the, I have not been able to get out there, but where is because of where it is, but where is the wetlands there based on that? And the only reason I ask is we've had a lot of issues around Eastern equine encephalitis and other mosquito-borne diseases. And where is the wetlands? Because I was wondering if you were going to do anything in your regular maintenance about treating during midsummer this for mosquitoes.
So those are good questions. One of the reasons, and we found this on some other projects that we're doing, especially associated with pharmaceutical companies, a very high level of concern about mosquitoes and access to building from insects and pests and everything like that. So this is being designed as a dry bottom detention basin. It is not intended to hold water, which certainly helps with, at the end of storms, it is intended to drain, correct me if I'm right, Will, within 72 hours, which is the time frame that is intended to prevent mosquito growth and fostering. And then Will was pointing out it's actually off-site on adjacent to the highway, the DOT land. Is where the wetlands are located. So they're actually off our property. And we would not be treating or otherwise affecting anything to do with that. We're beyond 100 feet from, all of our work is outside of the 100-foot buffer zone.
Thank you. Now, I'm a little confused, so please maybe your LSP or your engineer can explain to me. If there is some contamination in that area and it will drain during a large rainstorm, won't that affect the contamination that's there? In one way, I thought they were clay lined, on the other not, because we didn't want infiltration, but now I hear that it's going to infiltrate. Please explain that to me.
And maybe I misspoke. There's no infiltration proposed for the basin. It will drain out within 72 hours because of the outlet and the way it's graded. It will be clay lined to not allow for infiltration, or as Matt, I think, better stated, a low permeability soil or something to that effect, a better description.
Good, thank you. That's great. And then I got just a couple more quick questions. And I like the idea of a science area, and I'm happy that it's going to be a laboratory. But where would be the area within the building for a vapor barrier? And is that vapor barrier going to be passive or active? And please tell me why it should be passive or active.
So I'll answer a piece of that and then turn it over to Matt. The specific locations within the building footprint are not 100% defined because it's going to be based on the building layout, interior design. But any space that would extend down within that parking level, again, as I mentioned, lobby, stairs, things like elevator pits, things like that, would be vapor barrier lined. And I guess you would call that passive, and I turn it over to Matt. I think he'll be able to tell you, and I think Christine said this, it's actually a requirement above and beyond the MCP, the Massachusetts Contingency Plan requirements, to put in the vapor barrier because of the conditions out there don't actually warrant it. But Matt, you could probably elaborate better than that, better than I.
Yeah, that's exactly right. There's the design is still evolving a little bit, but based on what I know right now, I don't see a need for that barrier for a couple of reasons. Okay. One is that we are going to have parking underneath, and essentially, you don't need to put a barrier venting system when you otherwise are managing exhaust. And that's DEP policy. That's how buildings are designed nowadays. So where we can put parking under, we like to do that on contaminated sites. What's particularly interesting here, I guess the second thing is, again, the contamination in groundwater is in the bedrock. So it's in the fractured bedrock. The groundwater above that in the overburden is actually clean. So the groundwater contamination is sort of diving down, if you will, from 200 and kind of going under. So you've got this sort of clean lens of clean groundwater on top of it. And in fact, through that white area that is the building, there are two historical wells there that have had groundwater, overburden groundwater that's been clean, that is non-detect, less than the numbers one would worry about for vapor intrusion. And then on top of that, even at that location furthest to the northeast where there's a bedrock well, it's actually below the clean water. Even that bedrock concentration is less than the standard.
So I have one quick question to you before you run away.
Yeah.
But don't run away.
Not going anywhere.
50 years from now, will that still be the situation there?
That's a tough one. I sure hope not, and I bet not. Nangle is managing the source area up at 200, and I actually just took a look back at sort of the progress they've made. And over the past 7 years, the residual mass that's there, they've pretty much chopped in half. I was kind of impressed by that, but we are again talking about fractured bedrock solute transport. So this stuff actually absorbs into the rock matrix and then slowly bleeds out over time. So it could be, it could probably be quite some time, but they've made good progress.
You mean it's going to get better, not worse? Is that correct?
Correct. Yes.
Correct. I just want to make sure that.
Without question, it's gotten better. It will continue to get better. They cut the head off the snake a while ago, and now it's just kind of withering away, if you will.
Okay. Susan and Christine, are you okay with all of those answers?
Yes, I'm okay. This is Christine.
Susan?
Yeah, just for a point of clarification, so you are putting a passive vapor barrier under certain areas of the building, and those are the areas that do not have the parking garage underneath. Is that correct?
Yeah, we would probably put a passive system under just the areas where, you've got a potential vertical pathway. Like picture a stairwell. It's this tube going from the ground up to the occupied area, or the, say, elevator pit, where it's this tube that could take vapors up. So that's done routinely. So on a building like this, that might only be, 10% of the area of the building once it's designed.
Okay, I understand that. But just remember, maybe is not the answer. Proposed condition number 5 requires it. Okay?
Right.
Thank you. I have no other questions.
Mr. Chairman, can I ask just one follow-up? And I'm just curious by the LSP's comment where he stated that the plan is still evolving or changing. I don't know the exact words, so I'm paraphrasing. But I'm curious about that comment.
I'm sorry, I may have misspoke, but exactly where the stairwells are going to be, I couldn't tell you as I sit here. Scott might be able to,
Right.
or Bill might be able to.
That's what I was referring to. Is the interior of the building is not fully in final design. So the location of stairwells and the lobby in the parking level will be refined. But as Dr. Weiner, Christine, and Matt have indicated, under any of those areas, a vapor barrier would be included.
Thank you.
And that's spelled out in the condition? Is it worded in a way that we're covered in case something gets changed in the plan or altered in any way?
Yes.
The condition that I viewed, and I don't know, Christine, I assume they're the same as what you had sent over, requires that a vapor barrier be put below any portion of that building as indicated, pursuant to the requirements of the MCEP. So we would have to include the vapor barrier anywhere underneath the occupied space as Matt had indicated. So wherever the occupied space goes, that's where the vapor barrier would be.
Thank you.
Are there any other questions? So, I think the Gutierrez company did a good job in answering all the questions. If there's not, do I have a motion?
Mr. Chair, make a motion to approve application for approval of site plan and special permits for 300 Summit Drive.
Dr. Saltzman, with the 16 proposed conditions, 16
Correct.
conditions.
Correct.
So the motion will include the 16 conditions. Do I have a second, please?
Second.
I have a second, Ms. Wallen-Jevitz. So I have a motion and a second to approve the approval of site plan and special permits for 300 Summit Drive, the Gutierrez Company. All in favor? Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Libby Wallen-Jevitz,
Aye.
and I vote aye, 4-0. Thank you very, very much for coming this evening and for answering all the questions. I appreciate it.
Thank you very much. Everyone stay healthy.
And I thank you as well. And I think we've had some good success working together, hopefully cleaning up the town and any prior history, and hopefully improving upon both the ground and the conditions, and bringing some valuable projects and companies to town. So thanks for working with us.
Thank you very much.
Thank you. Have a good night.
Okay.
Thank you.
Good night. You're welcome
Bye-bye.
to stay, but we're going to go on to staff reports. First, I have the environmental engineer.
Good night.
Good night.
Waving
Stay
bye.
well, be
Stay
be
healthy.
safe.
Yeah.
And Christmas is on. All right, let's go. Christmas on means that a number of people on that call do volunteer for feeding the homeless, and we are not going to cancel that for feeding the homeless. And I know Mr. Buckley comes every year, as well as other people who are on this call. Thank you. Environmental engineers, Christine, is there anything that you would like to bring up before we ask you some questions?
So just one thing, I know you already thanked multiple departments for their assistance with our flu clinic a couple weeks ago, but I really also wanted to reiterate thanks to the DPW, the rec department, and the school departments for being really instrumental in helping us get set up, get all the equipment moved over there that we needed moved over there for traffic control, generators and whatnot, and for the services they provided during the day of the flu clinic.
Thank you. Do we have any questions for our environmental engineer? None at all? Well, I have a few. Household hazardous waste follow-up. I know you spoke to Tradby Environmental.
Yes.
Were you happy with what they did? I thought they were pretty good.
I was extremely happy with what they did, especially it being the first time that we used their services. Unfortunately, they will not be doing such events in the coming year, 2021. So we'll have to go look for another vendor to collect the actual chemicals at future events.
Why is that? They didn't make any money, or?
They, I don't know the reason, but I think they've had to do staff layoffs, and they just don't have the capacity to continue to do the events in the future.
Thank you. I have one other question about complaints and investigations for COVID-19. I see that there were a number of these that I would not have expected. What are your types of complaints that you're receiving?
A lot of complaints about either employees or customers not wearing masks in public locations like stores and, get convenience stores and that type of thing. A lot of questions about different social distancing requirements, as well as mask wearing requirements for youth sports and activities, as well as inquiries about such restrictions at gyms and fitness studios. Trying to think. There seem to be a lot.
Thank you. Okay, any other questions? If not, I need a motion to approve the environmental engineers report.
So moved.
Second.
So moved by Ms. Wallen-Jevitz, second by Dr. Wayne Saltzman. All in favor? David McSweeney,
Aye.
Wayne Saltzman,
Aye.
Libby Wallen-Jevitz,
Aye.
and I vote aye. So that's 4-0. Which brings us to the Director of Public Health. Now, this is a complicated one because we have reports from the Associate Health Inspector for October 1st and October 15th, and we have reports from the health agent for October 27th, and then we have the Director of Public Health's report. So I'd like to ask, do we have any, first, the Director, would you like to present anything?
I just wanted to reiterate thanks to everyone again for the flu clinic. And we sent out the survey monkey. So if any Board of Health members who assisted should have gotten that. So if you haven't yet, please complete the survey because we're in the process now of trying to get feedback from everyone. Not only our volunteers, but also police, fire, school facilities, DPW workers, anyone who was there helping out on that day. Then I'm going to put the after action report together, and I should have that to the board in a few weeks, and then we'll be able to try to pinpoint areas where we can improve. So that's what's happening. We gave over about 508 vaccines that day. So that was consistent with what we normally do in a walkthrough type. I think that we're going to be able to, once we improve the ability of vehicles to get through, it looks as if we may be able to actually do more people in 3 hours in this type of format than we would do if they walked into the building. So we'll be looking at that.
Thank you.
Yeah.
Okay, first, does anyone have any questions about the Associate Health Inspector's report? We're just going to go through this. We don't have to vote separately, but first, the Associate Health Inspector report, Samantha's report. Samantha Hardy. We have no questions. Good. Now I want to go for either of the October 1st, the October 15th. Either. Okay, none. Do we have any questions about the health agent's report for October 27th. The only question I have is I'm counting 15 questions around food permits. Um, Can you tell us why so many questions and calls around permit renewals? 15 of them in 2 weeks.
Yes, that's because the permits are due very soon. So everybody is trying to get it. People tend to try to wait to the last minute, and we get a lot of people lagging. So there was a lot of questions about probably, did you get my food permit? Did you get my check? Have you, any last minute type of questions to be answered so that we can get all of their information in so that we can renew the food permits. So I would imagine that all those questions were different, but all related to getting food permits in and getting them in on time.
Now, are there any questions for the Director of Public Health, Susan's report?
Mr. Chair, just one comment, and I know everybody's thanked the various departments that made the food clinic successful, but it just, in the amount of time that I was there, it literally was enormous amount of cars from start to finish in line. And I just cannot believe and was really impressed by the coming together of really the community and making that such a successful day. I mean, you had everybody there from fire department, police, the schools. It just was an amazing, it made me proud to actually, and it might sound ridiculous, but it made me proud to be a resident of this community because it showed, when we're trying, in the flu clinic aside, right, it was really the test for readiness and that everybody pulling together. And when something or an issue happened, everybody was in contact and in constant communication with one another. It truly was a sight to see. And the flu clinic alone was successful, but I just think, kind of the side story of that is seeing the various departments and residents. I had a chance to walk down and talk to folks waiting in line in their cars. They all were, I thought they were going to be upset that it was half an hour wait or whatever it was to get through the line. Everybody was in such great moods, really appreciative of the town. And I just think it was a great community event, and well done by Susan and the staff and all the other departments that pulled together. I just want to make that comment about the really community pulling together on it.
To dovetail on that, Susan, do we have a list of all of the volunteers?
Yeah, yes, we do. So that's everyone that was there received a survey. So we have a list of their names and emails for everyone. And I did send out a thank you to everyone that participated on that day. And then thank you for that comment, David. Also, too, it wasn't just everyone who showed up on that day, but it was also people calling me ahead of time. So I had a bunch of different people calling me, heard what we were doing, say, is there anything that I can do to help? What can our department do to help? So I had a bunch of people reach out before the event, just wanting to help with it. So it was not only on that day, but was also leading up to it. We didn't need everybody's help, but they offered, and that was great.
It's great to hear. And just one other question, or maybe you could just make a couple of comments. And I know where it stands, but just maybe for the general population or the public to hear if they're watching. We do have 5 cases in the school systems in the last week. I know you're in constant contact with the school department, and I'm not overly concerned at this point. But can you just kind of talk through how that contact tracing is going, if there's any lessons learned, or if we're finding out things as we go along here?
Yeah, sure. So our most recent one in the schools was this past weekend. So myself and Patrick Locken, we have I think a good communication going. If he hears about that someone tested positive, he will text me right away and let me know. And then we get started on trying to contact trace and figure out who the close contacts are. He has a system in place for pulling up class lists and lunch schedules and the different kids' schedules and who they were with. And the different teachers and getting me that information as quickly as I can. And then we contact each one of those people just to make sure they get on isolation or quarantine. And then we'll do a follow-up with them. And we have a list that we send to the nurses of kids that we know need to be on quarantine. So I think that we have a pretty good system down now with how we do it. We've had, like you said, we've had a few, so we've gotten practice in that area. But as far as the cases that we have, there really is no connection between them within the schools. So really, it's the cases are coming from the community and going into the schools, and not that we're not seeing spread within the schools. So if we did see something like that, then we would have to have more of a conversation. But that is not something that we're seeing right now.
Yeah, that's good. And not that it's good that we have 5 cases, but it's good that it's not being, at least we're being as proactive as we can and very reactive when we're learning. And the cases are coming external from the school, and hopefully there's no connection there. So thank you for that.
And I'd also like to remind residents to continue to be vigilant about close contacts, because we're seeing an uptick in cases, and a lot of the ones that we're seeing, after talking to a lot of these cases myself, is that they're getting it from a small gathering with their friends or their family, or they went to go see their kids and some other people at a small household gathering. Those are the types of things that we're seeing. So it's not that they're in large crowds. It's that they're seeing more people in close contact in smaller types of gatherings. So people should just try to be cognizant of that. Try to stay 6 feet away from others if you can.
Thank you. Libby or Wayne, do you have any other questions?
No.
I just want to point one thing out. The magic word was this weekend, and we all know that Susan was with her family this weekend, but she works almost every weekend because of the pandemic. She works every evening because of the pandemic. And please keep this in mind. First, how committed and how outstanding our Director of Public Health is. And thank you, Susan. But also some of the reasons why we need an associate director to help out in these things. We're all in this together. This is not going away soon. And I don't think we're going to have a vaccine tomorrow afternoon. So I'm all set. Do I have a motion to approve the Director of Public Health's report?
So moved.
Second.
Okay, I have a motion by Dr. Wayne Salzman, second by Libby Wallen-Jevitz. All in favor? David McSweeney,
Aye.
Wayne Salzman,
Aye.
Libby Wallen-Jevitz,
Aye.
and I vote aye 4-0. Before we close, just a couple of quick comments. First, Mr. Larkin will be on our next call. I will speak to him within the next week or so that he's on our next call to give us an update. I thought once a month would be appropriate, so he'll be on our next call. And as far as our subcommittee for the additional personnel, the Associate Director of Public Health, I know Mr. McSweeney is an expert in writing job descriptions. I'm going to ask him to be on that subcommittee with me. Mr. McSweeney, would you agree? Would that be okay?
Yeah, totally fine. Happy to help out.
Thank you so much. With that, before we take a motion to adjourn, Dr. Salzman, your final comments around the pandemic, please.
Yeah. Thank you, Mr. Chair. I don't want to be a Debbie Downer, but as the board knows and as our community knows, I am a physician who cares specifically for the elderly, and I have to tell you all that this pandemic is not rounding the corner. Hospitalizations are up in Massachusetts. Cases are up. And I'm sad to say that people are still dying from this every day. My hope is that a vaccine comes soon. It is not going to come by election day. The best thing we can do is what our director advised, and that is to be vigilant and continue to be the good citizens that we are. And as Dr. Weiner has said, we're all in this together. Wearing a face mask is not a political statement. It's a statement of safety and good citizenship and our care for our common, for our brothers and sisters in our neighborhoods. That's what wearing a mask is all about. Washing hands should be second nature to all of us, and of course, social distancing. So I would urge you all to continue to watch the news and stay informed, but understand, as a physician, I am concerned about all of you, and this is going to take some more time. So hang in there and be safe and well.
Thank you, Dr. Saltzman. Does anyone else have any final comments before I ask for a motion to adjourn? If not, do I have a motion to adjourn, please?
So moved.
So moved. Second.
I have a motion by Dr. Wayne Saltzman, second by David McSweeney. All in favor, David McSweeney,
Aye.
Dr. Wayne Saltzman,
Aye.
Libby Wallen-Jevitz,
Aye.
and I vote aye. It passes 4-0. Good night, everybody. Board, you have been outstanding. Everybody in town who calls me says the same thing. Our board and our staff is outstanding, and I couldn't agree more. Good night, everybody.
Good night.